So I will call the meeting of the Public Safety Committee for the City of Hudson to order on February 4th, 2021. Roll call, please.
Alderperson Alms, absent. Alderperson Hall,
Here.
Alderperson Morset.
Here. All right, any corrections from our meeting minutes from the last? Joyce, anything?
No, move to approve.
Second, all in favor? Aye.
Aye.
All opposed? Thank you. Number 3, discuss and possible action on proposal for additional police officers. Jeff?
Yeah, so you had asked at the last meeting, Joyce has asked, a couple other council members have asked, the mayor has asked. So I felt it was probably time to just put a proposal together as far as needs. Obviously, what we're experiencing in Hudson is a little bit different than what we see in other places, communities our size. Just because of our geography, our geographic location. But yeah, I mean, in order to keep pace with where we need to be and be able to handle stuff as it comes up, we need to continue to grow. We need to be more, diverse in the things that we do as well. And in order to do that, you have to have people to do that. So I guess, are there any questions on the written proposal or any questions on any of the documentation that was provided?
Quite thorough. So the bottom line is you're looking for 1 to 2 this year, 2021 cycle, and then probably an additional 1 to 2 next budget cycle.
Yeah, probably. Yeah, at least to keep up.
And the other part of the bottom line is this is a matter of raising taxes. Joyce, and I don't know if you're aware of that. Obviously, you probably are.
That's how it works, right?
Yeah. What is the cost
Services
per
equal taxes, right?
What is the cost per police officer with all of the benefits and?
Oh, per capita, I don't know. The total cost of a police officer with benefits is about $100,000.
Okay, so we got to figure 100,000 per officer added to the budget.
So let's talk. Oh, go ahead. I'm sorry.
No, I'm just starting to think out loud. So what was your question? Or
that's what I was going to say. Let's talk out loud. So Jeff, if we were going down the road, we don't have the officers in place to cover shifts or adequate shift coverage during the peak times we need it, correct?
We do. Well, we don't have, what we have right now is an open day shift, right? And then, depending on what is happening, right? I mean, we have pretty decent coverage in the evenings, but like this weekend, for instance, right? I mean, it's an all call kind of thing. It's like, hey, we're forcing people into work because we don't know what it's going to look like, and we're not going to be left high and dry, right? And I mean, quite frankly, the stuff that happened in early December, I could have had the entire police department on duty that night, as well as the sheriff's department, and it wouldn't have been enough people.
Still would have happened.
It was still bound to happen.
Bad people do bad things regardless of the rules.
But, I mean, I only have 5 or 6 people that are off on a given day, and if I want to add 5 or 6 people, those people aren't getting days off. They're going to work 20 days in a row,
So is this more of a rotation issue than it is a force issue?
No, because we have decent overlap. The big thing is not having that day shift filled. That shift is oftentimes covered by a patrol sergeant. So there's only two working until 11 o'clock. And then we get 2 or 3 afternoon cars that come out, right? And then at 4 o'clock, the day cars go home, but we have power cars that come in, and then the midnight cars come in. So we have adequate coverage for the most part throughout the day. That big one right now is that open day shift. Because it used to be And it was still last year pretty much, though it's hard to really read the statistics because we were shut down for so long. But it used to be, I mean, nothing happened in the city until about 9 or 10 o'clock in the morning. Well, now, I mean, from 6 o'clock in the morning through 2 o'clock the next morning, I mean, it's nonstop. It's busy.
Joyce?
You know, that's the big one right now.
Okay.
So do you have people on the list that on the eligibility list that you're ready to hire, or?
Yeah, we have a list. I haven't reached out to any of them to see if they found other employment. But this current list will be good, I believe, for another 8 months. So,
Okay.
Because we, you know, as you can recall, the beginning of last year, we were still short. I believe we hired 3 at the beginning of last year to fill our justified strength, right? So there is still a list that was created last January that is good. Well, I'm sorry, I misspoke. So it's good for another 6 months.
So strength of force for the public view is what, Jeff, for our population?
Right now, we have 28 sworn is our strength of force.
And you would like to be comfortably at probably 30.
Yeah, especially with the projected census coming in at about 15,000.
And the 15,000 strength of force should be what? I don't remember seeing that in the report.
Yeah, the Taxpayers Alliance and the FBI recommend 1 officer per 500 population. So that's
Okay, so 30 would be.
officers per 1,000. For 15 officers, that would be 30. So that'd be an additional 2.
Okay.
Well, it's obvious that there's probably the need for it. And if we want to be proactive, then we're going to have to budget for it. This would go to finance anyways. I guess I'm in agreement that we need to go to 30.
Yeah,
Bottom line.
I agree. I don't want people burning out on the job and not being
Well, and
there.
that's the thing. And they're all, you know, and we used to have one of the older departments around, right? Where the average experience level was about 15 years. Well, that's completely flip-flopped, and our average experience level now is about 6.
Okay.
So, you know, and they're still young, right? So it doesn't maybe affect them to their knowledge as much, you know, and that's a big part of my job is trying to get these guys to slow down and, hey, it's okay to take a day off. You know? It's okay. You don't have to sign up for every overtime shift that becomes available. You know, some of these guys don't have families yet and things like that. That's going to change some things, you know.
Yeah.
But the mental health and the physical health of these guys it gets concerning when we deal with an entire year of what we dealt with last year too.
Where are you at overtime hours year to date? Well, for 2020, what was your?
I don't have that right in front of me, but I can tell you we probably went 3 or 4 times over our overtime budget.
So about 100,000 plus?
I was close. I think it might have been 170.
Okay.
I think we're budgeted for 50.
So, and if you look at that, that's proof that outside of the obvious circumstances where we needed that, that's almost 2 officers right there.
Right.
So your budget is
And I
probably.
still came in under budget, by the way.
What's that?
And I still came in under budget.
So how did you come in under budget? What where were the savings?
Grants and donations bought a lot of stuff for us last year.
Where did you hide it? Weights and measures is probably like 200,000 in the hole. Yeah. So yeah, I mean, it's justifiable if you want to look at it that way. In a business model, that's an owie.
Right.
How much were you under budget last year?
How much what?
How much were you under budget last year?
I think it was a couple 100,000.
That much?
150 to 200,000. Well, a lot of that was because we were 3 full-time officers short for the first 3 months.
Oh, okay, yeah.
Right, so there was money out of the payroll that didn't get paid.
So Joyce,
Okay.
knowing we're both on finance, let's hold off on these questions before we go down that rabbit
And
hole.
I can
too
get that, I
far.
can have that information for you too at that time.
And let's focus in on the safety issue of more officers. And Jeff, would it be prudent to do 2 or 4, knowing we're gonna have to budget again? Do we hit our taxpayers once or twice?
A taxpayer question for me?
Yeah. I mean, it is a decision we'll have
Trying to make me the bad guy. No, I mean, it's a fair question. It's a fair question, you know. Obviously, the idea would be to do it once, right? Nobody knows what it's going to look like next year. That's why we were in kind of the position we were. I wanted to ask for 2 at the beginning of this budget cycle, but you know, with the unknowns with COVID, it was, hey, let's keep it flat so until we know what's going on. And
And then December hit and things.
blew up in our face. No, the whole year blew up in our face.
Yeah.
I mean, with the social injustice and the rallies and the marches and everything else that was going on, we were completely overwhelmed the whole year.
So if you were to ask for 4 officers now, figuring that, I mean, we're growing, the city is constantly growing. We'll be at 16,000 before we know it,
We're growing.
especially with more housing going up all the time.
Mm-hmm.
So maybe it would be better to,
And what's really telling about that too, and separates us from other communities, maybe not in the metro, but other communities in Wisconsin that are similar size to us, they're not part of a metropolitan area.
Mhm.
You know, they don't have a serviceable population of 70,000 people like we have.
My biggest worry though is we hire 4 people or even 2 and we have to lay somebody off. I don't want to do that.
Nobody wants to do that.
And I want to make it a budget that's sustainable into the future. And yes, we're growing. We can have the numbers run and justify how many. That's why I'll have to go to finance. But our recommendation, maybe it should be for ask big or go home.
and is it better to hire 4 all at once, or is it better to stagger them and bring them in one at a time?
Well, the reality is that they would be staggered anyway.
Okay.
The reality is of that list that we have, let's say we have 6 people left on that list, at least half of them are probably going to have other jobs, right?
Mhm.
One of them, let's say, doesn't pass background, or, you know,
Yeah.
we decide not to hire because they're not going to be a good fit, and we got to start a new process. So, I mean, it's not like we're just going to pull 4 people out of the air and put them in the police department. You know, it's a time intensive process, and yeah, we have a list, but you know, we can't guarantee that we're going to be able to hire everybody and start them a week apart from each other.
I would think we would recommend, Joyce, to the finance up to 4
Mhm.
officers.
Well, I'm just thinking about budgeting for this year right now, and that if they're hired, if they're hired sequentially, then we're not going to have 400,000 that we have to add to the budget right now. But next year we will have to add 400,000 to the budget.
Yes.
But figuring that, you know, you hire one now, and then one in a couple months, one in a couple months, and one in a couple months, then, you know, it probably would end up being about 200 to 250,000 total for this year. But then we have to budget for 400,000 for next year.
Mm-hmm.
So yeah, I think that that we should recommend I'll make the motion that we recommend the hiring of 4 new officers, up to 4 new officers before the end of the year.
I'll second. Jeff, we'll have to buy more cars, or how does that all pan out? Equipment.
No, because of our replacement plan right now, We're basically, to try and build our fleet a little bit, we're basically getting rid of one and getting two, right, every year. And then as cars start to get older, we assign those out to people that live in the city so that we can have, some more visibility, and supervisors have their cars, right? So when they get called to a scene, they don't have to go 3 different places to get there. They can just jump in their car and go. So we're doing pretty okay as far as car equipment.
Nothing wrong with doubling up and then having foot patrol either, or bike patrol.
And we do a lot of that, especially of late. With the downtown area, there's foot patrols and double up patrols and things like that when we have events, for sure. So no, I don't foresee a need to be purchasing more cars at this point.
Okay. Any other conversation on this motion? If not, all in favor?
Aye.
Opposed? Motion carries. Recommend to finance to talk the budget out on it.
Mhm.
Thanks, Jeff, for that lengthy report, though. It was good. It was informative.
Yeah.
All right, number 4, discussion possible action on street sign requests and installation policy.
This was a Dean item. He can't be here today. I also see that it's on Public Works for Monday. I don't know if you want to kick this can to next month.
Well, here's what I don't want. I don't want Public Works trying to tell us when, where, what, how, and who to put a sign up. If we have a sign that needs to be put up, we need to have it put up. I don't want it to compromise safety. So we will need to discuss this as well at this level. And I don't want to see it to go to full council until it comes to public safety. That way, every chief has their say on the sign request and installation policy.
Right.
So we'll postpone this
Okay.
till our next meeting.
Mhm.
Is that fair, Joyce?
Yeah, then after we can see what Public Works does with it too, and then take it from there.
Okay. All right, number 5, discussion possible action on traffic safety on 11th Street between Vine Street and St. Croix Street. This came through Joyce, through Jeff.
Yep.
Yeah, this came through Joyce, through Jeff, and then through Dean. He thought this might be a good place to discuss the speed hump policy. That's why I attached that to this item sheet, or issue sheet, I guess. But again, he's not here. We can address the safety issues, I guess, without the speed hump stuff, because I don't know anything about the speed hump stuff.
Joyce, fill us in briefly on what's going on up there.
Okay, so the let me find the email that he wrote, but he just said that he lives on 11th and the students are just zipping through there. And there's just, he's concerned about the safety. So has there been a black box study done there yet, Jeff?
No, not yet. I started with patrols, especially in the morning for the school traffic, and the afternoons for the school traffic. I started with radar patrols out there. I haven't done any black box studies yet.
Okay. What were the results? Did they?
Couple of warnings.
Okay. So
Since the time you sent that out, right? I mean, that day I sent out a, hey, extra patrol, and these times can you run some radar and see what's going on up there? And the report back was a couple of warnings.
okay.
How's this? Oh, sorry. Go ahead, Jeff.
No, so I think that what we need is probably the black box put up there to monitor the speeds before we do anything more.
Start with that.
Mm-hmm.
I was trying to
bring
wait
it
for
back
the
next
temperatures
month.
to get above 0, you know.
Oh.
The battery might
The
only last 2
battery
days.
doesn't work too well.
But later, mid to late next week, it looks like the temperatures are going to warm up from this polar
Okay.
blast that we're about to get. So I can throw it up there late next week, probably.
That sounds good. So let's just bring this back next meeting.
Okay.
He's more concerned during the week, right? So is it as
Yes.
important to have weekend traffic flow? Because I don't think there's a lot of weekend traffic on that road, to tell you the truth.
Probably not.
So should we
mainly
just
when
plan
the
on
school-
trying to do like a Monday through Friday kind of thing?
That would be fine, because it's the students. Usually, it's right after school. They're all in a hurry to get out of there. Although I haven't. Those are my own observations from my own neighborhood, not observing his street.
Yeah, and that is a connector from the Bear Drive kind of area of the city up to the high schools.
Is
Yeah.
he a newer resident?
I don't know. I haven't met him, and I don't know how long he's been there.
My train of thought is what was so different than what I was going to school, besides the obvious. I mean, there's a little more people. How has it changed that much that kids are speeding through there?
Probably that there are a lot more kids, of course, but probably a lot more cars. You know, the city has become more, as the city becomes more affluent, then more of the teenagers have cars available to them.
Yeah. So my guess is that we're looking more towards enforcement, not necessarily traffic control. Just a thought, and we could talk about it later too as well.
Well, I like the, I think that the speed hump policy needs to be addressed. And that needs to be done soon.
Yeah, well, we can do whatever. I mean, I don't remember why we held off just because of the snow. We can't really do anything until spring.
Yeah.
I didn't see any issues with it. My only issue was I wanted to make sure everybody in the area of the neighborhood where we're looking to put them have their input.
Yeah. I think that my thoughts were that we would use a temporary speed hump to see how well it works in the neighborhood. Send a notice to the neighbors that we're putting in a temporary speed hump and that we would like feedback on it, and then put in the speed hump and see what kind of feedback we get from that, and then decide where to go from there.
So let me ask you, be kind of being plain devil's advocate, Joyce, because I like to do that with you.
I know you do.
What happens when we have a newer kid with a brand new driver's license speeding over one of those bumps, loses control of his car and vehicle, and we ended up making a worse situation worse? I don't know if there's information out there to address that.
That would be a good question. I know that, well, my husband said that one of the employees at the county has come from Minnesota and has a lot of experience with speed humps and is very in favor of them. So I wanted to get more information from him. So I will contact.
Ask the question the way I asked it.
Yeah. Okay.
Because that concerns me. Just like when we stick these roundabouts in, new licensed people, they don't get that. I mean, I don't know if they study that now in driver's ed or not, Jeff. I don't know. I would assume they do now.
Yeah, I'm not sure. I've been involved in that for 20 years.
So it's a concern. Young kids with a speeding vehicle we don't want to attribute to make the problem bigger than what it should be.
Okay.
Just what I thought.
Yeah.
So let's
I will ask that question.
put
All
this
right.
back on.
Yeah, and I'll put it back on for next time.
All right.
And then, and I'll talk to Dean about this too, because he may have some more information about that as well.
So in the meantime, we're putting a traffic data up there
Yep.
and more patrol. Okay. I don't know. I think we need a formal motion for that. We'll just have that on the next meeting.
Okay.
Number 6, informational items. Anything? Nope. EMS, John, you did send us out a report earlier. If you want to give us the executive or.
Yeah. Good afternoon. So we had our meeting, the EMS Performance Review Committee meeting on Thursday. I think it was Thursday last week. So we presented the fourth quarter report and then the annual report. So I'll just review the city. Obviously, we went over all the communities that we cover over there. But for your guys' interest, I'll just cover the city. And if you have any questions, by all means, stop me. And you have the data now. I emailed it to Randy, Joyce, and Jeff, I think, too.
Yep.
So for fourth quarter, in the city of Hudson, we did 290 calls. Of those, 215 required an emergent response with lights and sirens. We had an overall average response of 4 minutes. And then the fractile, the 90th percentile, we did in 7 minutes and 13 seconds. So 90% of the time we're on scene within 7 minutes and 13 seconds. During the fourth quarter, we had 2 mutual aid calls. And I will just note that one of those days, we did 52 calls that day. That was a record number for us in a 24-hour period. And we had 5 calls back to back, or I don't know, at least 4 calls back to back in the city of Hudson, and one of them we were not able to do. So mutual aid was for that, and then the other one was for the incident downtown at 1 a.m. Was that December? Yeah.
Mhm.
Anyways, so I think those are really good numbers for fourth quarter. And then for annual data for the year, we did 1,196 calls in the city. Of those, 833 of them were lights and siren response. So we had an overall average response time of 4 minutes and 4 seconds. And then the 90th percentile, we were at 6 minutes and 53 seconds. And for the year, annually, we had 3 mutual aid calls in the city. So that's well below what we agreed to in the contract. I know we wanted to definitely keep that number under, I believe it was 5% in the contract. And we did an overall volume for 2020 as a service, we were 10,394, and we responded 638 times to mutual aid for other cities. So we did far more mutual aid than we did as an entire service. As an entire service, we requested mutual aid 27 times throughout the year, and 6 of those were interfacility that we made the choice. I explained this at the public or the Performance Review Committee. Typically, we do all of our own transfers, but this year was an extremely busy year with COVID, and there was no beds available a lot of times in the Twin Cities area, and we were doing transfers all over. And if we're having a busy day, I mean, we can sense usually if the day is busy and if not, or if it is or not, and we make the decision if we're going to do these out of the metro area type transfers. And we a lot of times will try and farm them out to our mutual aid partners around us. So we do that behind the scene. We don't do that for 911, obviously, but for those types of calls, we have them. So we did that 6 times last year, interfacility. And a couple of those were out of Hudson. The rest were out of Lakeview. So I think the other data, I won't go over it here unless you want me to, but again, you have the information there. It just kind of breaks down what we did through the year, the number of calls that we responded to lights and siren to the scene, and the number of times we responded from the scene back to the hospital lights and siren. And that kind of gives you a sense of the urgency of the situation. So an example of that, in the city of Hudson, we transported back to the hospital lights and sirens 61 times. So 61 times those patients were critical enough that we needed to go from the scene back to the hospital lights and sirens. In that data, the other thing you're going to see on that form that might have questions are the blank. There's a blank spot in there. The 299 calls, there's nothing there. It's blank. So those are the times where we were canceled en route. We were paged out, canceled, never got to the scene. So there is no section for that. Technically, that should fall under not applicable, but it shows up just blank if the crew doesn't check that spot. So not applicable, there was 133. So that's what those are in that area. And I think the rest is pretty self-explanatory. Oh, I guess I should mention too, there was 700 interfacility transfers that we did out of Hudson Hospital. So we don't include that in the normal data, but that is calls that the 2 ambulances in Hudson are doing. And then obviously we're moving coverage over there as needed for those situations. 24 standby events for the year. So the total calls for Hudson in 2020 was 1,896 calls. Do you guys have any questions on that?
Is that an increase over the year before?
Well, we didn't have a full year. You know, we started in September 9th, but for us, that was a all-time record. I mean, it's obvious we're going to have a record year because of the new service area, but it's over what we budgeted for. And I think we've had this conversation before. I can't just say it was COVID related.
Sure.
It was a very busy year. And it's different when you talk to other services, you hear that they didn't have a busy year. It was kind of average. And then you talk to another service and they say, yeah, they were really busy. So what I've learned over the years is there is no predictions in our business. I can't, we don't know what's going to happen from day to day. So we just got to be prepared for what we usually see and do our best. And I think we're doing that.
Well, I commend your staff. I think you guys have done a great job from what I've heard from the general population.
Yeah, thanks. We have not received any complaints about the service. Well, I shouldn't say that. We had one complaint in the city of Hudson, and that was just 2 weeks ago. The situation was it was an unusual situation, and the service people at the facility, it was a business, felt that the one paramedic was just not being professional with them, and Bridget did a good job of taking care of that, and I don't think it will happen again. We followed up with the person that filed the complaint, and the thing is, so you guys know, most of the time those complaints don't come directly to Bridget and I, because a lot of times people don't know who to contact, so they contact the hospital. And if they say anything about I had a concern or an issue, it goes right to our patient representative, and everything is logged. It's everything is noted and documented what the complaint is. So that's where I received the complaint from. But other than that, I didn't receive any other issues throughout the year. The thing, again, I think we talked about, Bridget mentioned in January that we didn't have any open shifts the entire year in the entire service area. There was a couple of times where we had people get sick while they were at work. If they came down with COVID symptoms, they had to go right away. So it left us short for a couple hours, but our staff just stepped up and covered the shifts, and we really hope that we can keep that going. I've never seen that in all my years of being in this role. So we're pretty excited and proud to have the staff that we have. We are hiring right now. We have 2 open positions. And we have one new person that's going through orientation right now. And those were the positions Bridget talked about in January. So we've made some contingent job offer, and we have another one that we're probably going to make the job offer, but we have to do the official interview process with that person. So I think we're sitting really good right now. We have no open shifts right now on the schedule. Bridget's been in contact with the Hot Air Affair people there. So we kind of know there might be some changes this weekend, but we're ready whatever happens.
They're looking to cancel a final decision tonight, I believe.
Yeah, that's what it sounded like. So sorry, Joyce, I just kept rambling.
No, that's okay. I didn't mean to interrupt you.
No, that's fine.
So how much has COVID affected your staff as far as them coming down with COVID and being out?
Yeah, that's a good question. So I think we had 5 people that contracted COVID in the last year. We really hit a peak right around November 1st. So that week, I was on vacation, so I missed out on it. But we had a week there where people were dropping like flies. But everyone did really well throughout their quarantine. Nobody got seriously sick, and everyone was able to come back after their quarantine. We did have a couple people one employee that got quarantined twice because of an exposure, but he never came down with it. So twice he was exposed. Once was by a family member and once was on a SWAT call out. And so that was good. All of our staff have received their 2 shots of the vaccine. We had 2 employees that are at this point undetermined whether they want to do it or not, but the rest of the staff have all taken the shots, and we're done. Everyone's had their 2 vaccines. And we did have a number of staff have reactions to the vaccine. So we had anyone that had COVID, I think with the exception of Bridget, I think she did pretty good, but everyone else that had COVID that got their shots all had reactions where they 103 temp, 102 temp, not feeling well, but it subsided in less than 12 hours. So
and that's what I've been hearing is that the people who have had COVID usually have the bigger reaction to the vaccine. So did you have routine testing for everybody, or did you just have testing when they had symptoms?
Yeah, when they had symptoms. So if anyone had symptoms, we went to one of our, Stillwater Medical Group was doing a lot of the local testing. So we would send them up there, and because we're a healthcare provider and they know the work we do, we could get everyone in right away. And then I think in October, I think we were able to turn the tests around. Our own lab at Lakeview was able to do the testing within hours. So
nice.
Yeah.
Mm-hmm. I've got another question about your annual report. One of the things that we talked about during the negotiation process was tracking the time between when the call comes into the county and how long it takes to transfer everything to Alina. Have you done any tracking on that? And if so, what were the results?
Yeah, I haven't done any tracking on that other than day to day when I monitor the calls. And I guess I didn't see that there was language in the contract that said that was our responsibility to do. I will tell you honestly, that continues to be a problem. We haven't had the conversation with the county yet, but there is a delay, and where it has come to light is a little bit of background between Troy, town of Troy, and us. We had met with them when they were negotiating with Alina, and we met Alina, Lakeview and Town of Troy. And the Town of Troy wanted to change the boundaries because Lakeview now sits closer than Alina, and they were coming a lot further. And Alina, like Lakeview, if another service can get there quicker, it only makes sense that that service would do that. So we met with the Town of Troy, and we made an agreement that we would, between Alina and Lakeview, we would make the lines appropriate for response times. So Alina did a lot of the work because they have all the technology to measure the response times, and they came up with a map. We sent it to Town of Troy. Unfortunately, it was going to change their per capita quite significantly, to the point where Alina had said that they had already agreed to a dollar amount, and this would change the dollar amount, and they weren't willing to change that dollar amount because they're building an operation based on a dollar amount that was agreed to a year ago. And I agree with that. So the Town of Troy just had to leave the boundaries the way it was. So the agreement between Lakeview and Alina was, you know what, we're both dispatched by the same dispatch center, and we have the technology to determine what ambulance is closer to the call. So our decision was, as a service, Lakeview might respond into areas that yesterday River Falls went to, and vice versa. Alina could potentially take calls in our area based on where the ambulance is. So if there's a River Falls ambulance now, Alina, going through Hudson, and they're closest because the CAD system immediately picks up on that, they'll take the call. Just like if we were leaving River Falls Hospital and a call came in and we were closest, they would give us the call. So that's what we agreed to, and the system that Alina has will dictate which ambulance is the closest. We let the Town of Troy know that at their December meeting, and right away we found out we had major problems with it. And the problems, it's not going to work. And the reason it's not going to work is because of the way the county does their dispatching. So the county dispatches everyone first, and then they call Alina. So some of them times it's been quite significant in delay for us getting the call. And if we were closer to the call geographically, but the county had already dispatched River Falls to the call, it didn't make sense to send us to the call, because then it was going to delay it. So those are some things I was hoping that we could get Alina to put some pressure on the county to change that, which they've worked with them a little bit, but nothing has changed yet. So that has been all along what I've talked about, where at some point we might need the support from you guys to make that change. And really what it is the ambulance gets, I mean, you can notify law enforcement first. I have no problem with that. And that's what Washington County does. One dispatcher calls law enforcement, sends them. The other one's calling the ambulance dispatch. So in Washington County and Ramsey County, we're receiving the page either simultaneously with the fire department and the police, or we're getting it a few seconds before they do. I've never seen it operate the way it's operating over there, so here's the other piece of that, Joyce, is our response times are better looking for us than what they truly are.
Yes, that's my concern.
Right.
What are the real response times based on it?
But that's in the data. That's not the real response. So our policy is our crews, when they hear the pager go off, everyone has to carry a pager through St. Croix County. So they hear that page go off, they go en route, and they arrive at the scene. It might be a minute away, and they get to the scene, but we haven't received the call yet from St. Croix County. So that there's no numbers yet. And sometimes that can be 5 minutes.
Mhm.
That's on the long end, but the crew is already at the scene. They're already physically there with the patient when we receive the call. The problem on our end is our data is all driven through our dispatch center.
Okay.
So if it took St. Croix County 3 minutes to page us and our crew's on scene, they're still on scene, but yet the times aren't going to reflect that on scene time that they got there.
It's a skewed data.
It's
Yeah.
skewed
Yeah.
data.
Well, I'm aware of that. That's why I'm asking about it, is wondering, well, one of the concerns that I had expressed before was, all right, are there any times when the crews are not paged right away by the county? Even before being sent over to Alina.
No, I don't remember that happening at all. There's been times that they've never called Alina, and the crews, when the crews tell our dispatch, that happens a lot of times in Washington County or Ramsey County. If we hear law enforcement going on something, we know we're going to get called for it.
Mhm.
Our crews will call our dispatch and say, hey, we just heard Stillwater police go out on a shooting. I'm just making that up.
Okay.
And so Alina says, I'll call Washington County. Or they'll say, we're getting the call right now. Same thing happens in St. Croix County. Our crews go out. The downside to that is, for us, is it doesn't activate the call in the CAD. So they don't have the mapping system without us getting the call.
Mm-hmm.
The crews have done very good without having the mapping system. They've learned the city, I think, pretty well. I've not known of any issues where they had trouble finding a call, but it defeats the technology that we have the way that it's been going.
Mm-hmm.
So, I think it's time that we need to sit down and just talk with the county and just ask if they could do something different.
Maybe someone could talk to the county board member up there.
Yeah, I would rather just, yeah.
I happen to know one pretty well.
Yeah. I would like to, I don't want to make a big deal of it because it's the way, and you guys remember the meetings. It's the way St. Croix County has done it forever. They think that that's the appropriate way to do it. And that's why they wanted us to get pagers. I understand that. It's just, things have changed. And you look throughout the country, when we were going through all this, I talked to a lot of services on your side of the river. No one does that. The 911 center is calling an ambulance dispatch center that's separate, and there's no delay.
Yeah.
So it's things that have been done one way for a long time, and it's worked well. It works well, but for us with the technology, it delays things.
Mm-hmm.
And our crews, again, I give our crews a lot of credit for following our requirements to go en route right away when you hear that.
Yeah. I'm just wondering how you would track that. I mean, the county would have to do the tracking on that.
It's not easy to track, Joyce. I mean, we could request the data from the county but it's raw data, and someone would have to sit down and log. I mean, we could get it electronically from the county, but it would be a lot of man hours to put all that data together and see what the response is. But I think maybe we look at a month. Maybe I just randomly we pick a month, and maybe I'll pick our busiest month.
Okay,
and I'll
that
just
would be a good
ask
idea.
Terry to pull some data, and that way we're going to need to do that if we want to approach the county and request that. But
Correct.
so
Okay, that sounds like a
that's
good
something
plan.
I can take that on and keep you guys up to date on that.
Yeah.
But I just,
Okay.
I mean, I know this is a public meeting, but we have the service that we've had with the county, I think, has gone very well. It's
Mhm.
just the little things that, in the way we operate, and now at Alina and River Falls, it's different, and it defeats a lot of what we do. It slows down our response for another ambulance coming over to cover. The longer it takes for that to get into our system, if the Stillwater crews are busy and just not paying attention to the radio, they might not hear the Hudson truck go out on a call. It's hit or miss if I hear the St. Croix County pages go out in my office at the hospital, and the same thing down in the crew quarters. They might not hear that the Hudson trucks are out on a call. They call county on the county frequency, but we won't hear that over there. So it
Well,
sets us
keep
up
us-
for missing a call.
Keep us posted on that. That's a concern that is going to be right in front and center. So
Yeah,
Mhm.
I will.
Well,
So I'll do some follow up with Terry, and I'll let you guys know at the next meeting.
Good, thank you.
Yeah.
And the other thing I was going to say is that, if there were complaints, I know that as,
we'd hear 'em.
yeah, we'd hear them, and I
Yeah.
haven't gotten any complaints, so that's good news.
Yeah, I think I said at one of the council meetings that in my history, the complaints I usually get is about billing, and it's typically the billing piece of it is typically the person that doesn't have insurance and they don't want to pay the bill, so they find a reason to complain about it, and I've not even received any complaints, questions, anything about our billing, or our billing office is not either, because I'm the first one they call when they get those questions. So
You better knock on wood now that you said that.
I know it. I know, but
Right.
it's important for you guys to know that.
Mhm.
Absolutely. Thank you very
Okay,
much.
Thanks.
Yeah, thanks, guys.
Is Chief St. Martin on?
He probably fell asleep after my talk.
All right, police department update. Jeff.
Nothing really to update. As you know, we lifted the emergency ordinance here for this weekend. Will be the first kind of test to see how that's going to look. Thankfully, it's going to be, polar bear weather. Hopefully that calms down, but we're planning for at least the next, weeks to really up staff just as a precaution to see kind of how people handle it. I don't know if Minnesota meets again to decide whether or not they want to turn their dial anymore. But regardless of the fact, and until they do, we're gonna continue to beef it up just to be on the safe side. So it'll be noticeable again.
Have your guys been vaccinated?
We've all had our first round. About half our department decided to do it. The other half did not want to. So those of us that wanted to participate have had the first round, and next week we'll get the second round. So
Okay. Any outs because of it? COVID?
you broke up a little bit. Anybody
Anybody
out?
out?
Nobody is out currently. No.
Very good.
Mhm.
Anything else, Jeff?
No, that's about it.
All right. Other items for future agendas, we've got the two that have got to come back. I don't have any at this time.
I don't have anything else.
I'll move to adjourn.
Second,
All in favor? Aye.
aye. All right,
Thanks, everybody, for the
Good night,
time.
everybody.
thanks. Good night.
Stay
Good
warm.
night. Thanks.